Okay, so I'm going to be talking a little bit about smart beds and the impact that they have had on the healthcare system, especially on nurses and patients. So, some of the biggest benefits, or I guess the biggest benefit of smart beds, has been the ability for nurses to track and have a constant monitoring of patients, even when a nurse isn't in the room. So, smart beds can help monitor and track things like weight, vitals, patient movement, things like that, and record it consistently throughout a patient's stay in the hospital. Smart beds also increase patient safety and comfort, especially for those patients who are there more long term and who have been in bed for a long time. Then there are other fun features that I was reading about that some smart beds have, like language translation for situations where there's a language barrier between the nurse and the patient. Some have like different music settings or like nature sounds, waves, things like that. So overall, smart beds have been a huge game changer, and there are a lot of benefits and different features that are being added consistently.
One current nursing issue is telehealth. So, telemedicine is relatively new and allows patients to have virtual appointments where they can tell doctors their symptoms without having to come in person, which saves them a lot of money. It's important now because it reduces the exposure of sick patients to others by letting them stay home to receive medical advice and quick diagnosis, and it also saves both patients and doctors a lot of time and money for something that might not require in person care. Some interesting facts about telemedicine is that it has been expected to increase by millions during recent years, and the majority of hospitals in the US are now using telehealth. So it's a pretty big development that's been happening lately.
Wearable devices. Do you own an Apple Watch, Fitbit, or a phone? Then you own a wearable device that can help you take your health into your own hands. Wearable devices are transforming the healthcare industry. Apps that act like a stethoscope are not only less intimidating for younger patients, but they also eliminate human error. Wearable devices allow nurses to communicate data more quickly and more efficiently. This allows patients and nurses to maintain a constant monitoring of health. So, the next time you think that only hospitals have the technology to track your heart rate, sleep, exercise, or respiration, just look at your phone.
Infusion pumps, or IV pumps, are described by the FDA as medical devices that deliver fluids such as nutrients and medications into a patient's body in controlled amounts. Automated IV pumps have become very important in the life of a nurse. These automated IV pumps are able to help nurses administer IV fluids by ensuring that the patient is receiving the correct amount. Richard Byrd stated, "It can be used to detect cancer in a single drop of fluid." He also stated that IV pumps are able to help personalize treatments for each patient and help current and future patients based on one patient's data.
One of the technologies in nursing is a portable monitor, which allows nursing professionals to check up on patients, even if they're on leave, because nurses are constantly on the move, maybe helping out someone else or checking their papers and their files. There's a variety of reasons why nurses are so busy. So the portable devices monitor vital signs, including ECG, respiratory rates, and oxygen saturations, while it transmits the information back to the center of the monitor. So that means that nurses will be notified by when there's an emergency. And that's obviously significant because if they aren't there in the room when the emergency occurs, this allows them to get there in a timely manner. And most hospitals have nurses check levels hourly, just to ensure that everything is okay, and if it's not, then they can tend to that. And they can track note stats at the right time with these monitors, even if there are other things going on, and it helps them monitor patients anywhere in the hospital. The alert alarms that are sent to nurses use portable monitors to give them safe advice. So nurses learn how to utilize the portable monitors within their specific job, whether it be a hospital hospital or a nursing facility. And yeah, it's just a very valuable tool, and